The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries.
The World Health Organization declares the coronavirus a global public health emergency. Hello, I'm Nathan King, sitting in for Anna Naidu, and this is The Heat. Hello again. In a rare move, the World Health Organization has declared the coronavirus an international public health emergency. The outbreak that began in Wuhan, the capital of China's central province of Hubei, has spread to more than 8,100 people, with 98 cases in 18 countries outside China. In his news conference, the WHO Director General praised China in its response for the outbreak and outlined several recommendations aimed at preventing or reducing cross-border spread of the disease.
We must support countries with weaker health systems. Third, accelerate the development of vaccines, therapeutics, and diagnostics. Fourth, combat the spread of rumors and misinformation. Fifth, review preparedness plans, identify gaps, and evaluate the resources needed to identify, isolate, and care for cases and prevent transmission.
There's a lot to talk about, obviously, so let's get straight to our panel. Joining us from Beijing is political and economic affairs commentator Ina Tangen. Dr. Eric Ding is also here with us in Washington, D.C. He's an epidemiologist at the Harvard Chan School of Public Health. And with us from New Haven, Connecticut, via Skype, is Dr. Xin Chen. He's an assistant professor of public health at Yale University. And Dr. William Schaffner is a professor of preventative medicine at Vanderbilt University in Nashville, Tennessee. Thanks so much to everyone for joining us, especially at this busy time. And it's great to have so many experts because there's a lot of information out there, as you know, Dr. Ding, that is worrying a lot of millions of people around the world. So let's just start by asking, what is a public health emergency of international concern? Why was it declared now, and what does that mean for tackling the coronavirus going forward?
So public health emergency of international concern is a very rare declaration. They've used it for SARS, for swine flu, for Ebola.
Yeah, 6 or 7 times.
Yeah,
right?
a few times, but it means that it's a call to action for countries that there's a high risk of this virus coming to you, and you need to prepare. And it leverages coordination with all the countries' ministers of health, that they must coordinate their strategies and control with the WHO.
They don't have any powers, do they? But
it is not a mandatory, but it is, they must coordinate at least their strategies. So it's also very symbolic in terms of mobilizing resources, and also in the global health realm, in mobilizing donations and other resources beyond just the countries and WHO.
So it's a call to arms, essentially,
yes.
for the global health community and governments around the world. Dr. Schaffner, what does that mean now? What happens next, and what should be the global response?
Well, one of the things that will happen is that China will be relatively isolated. Travel to and from China will be substantially curtailed, and the other countries, as Dr. Deng just said, will be asked to make major contributions to help China deal with this problem. And if we weren't all on the alert around the world, we certainly are now, and we are to take preparations internally such that if cases come to us, we are prepared to deal with them, both clinically and from a public health point of view.
Dr. Shi, before I get to you, I want to play another clip of the WHO Director General, who seemed to really sort of try and emphasize China, the positive that China has been doing since this coronavirus emerged in late December, early January. Let's just take a listen. I'll ask you a question off the back.
The Chinese government is to be congratulated for the extraordinary measures it has taken to contain the outbreak. despite the severe social and economic impact those measures are having on the Chinese people. We would have seen many more cases outside China by now, and probably does, if it were not for the government's efforts and the progress they have made to protect their own people and the people of the world.
That was Dr. Tedros there, the WHO Director General. Dr. Shi, I mean, is he right? We've seen essentially the quarantine of over 50 million people now. We're seeing these hospitals being built in days. This is not just a regional effort. This is the full weight of the Chinese state being deployed here. Is that enough? And what else obviously needs to be done?
So I think from this announcement declaration, definitely in the last few days, there was some more bad news that we have more cases accumulating and reaching most of the provinces. But at the same time, the government has never stopped emphasizing very strong measures to encourage people to stay at home and all kinds of proactive measures in order to diagnose people and treat people, especially trying to find people at the early stage, very early diagnosis and early treatment. So that has been done and achieved quite a lot. Otherwise, we wouldn't say the situation as a better. And also there are many different measures at different levels, like health insurance reimbursement policy change, and there's also they even implement some new technology like telemedicine to diagnose people, and also have health education for individuals to adopt, to implement, like washing hands and the correct way to wear face masks. Those are done at all the levels, trying to contain this virus.
And Dr. Shi, just a quick follow-up. What can we expect in China in terms of peaking of cases? When do we expect potentially, or is it too early to say, the virus to peak and tail off? Remember, obviously SARS lasted a long time. What do you think is going to be the case with the coronavirus?
Yeah, as many other experts do, I also keep monitoring the new cases, both the confirmed and the suspected cases. I think now we are in a stage of more volatile, like there are more fluctuating trend of confirmed cases and suspected cases. So we are closer to the plateau of the disease outbreak. So after that, there would be more stabilized trend of the confirmed and suspected cases. But this is a milestone we need to achieve at the beginning. So we are closer and closer to that stage.
Ida Taggart, I know you're not a doctor, so I won't ask you a medical question, obviously, but you are the man on the ground there in Beijing. What's it like in terms of the national attitude right now in China? And is it a good thing in a way that this happened during the Lunar New Year when everyone's at home so they can kind of extend the holiday and tackle this? Or what are the complications? And essentially, where does China feel it's going with this?
Nathan, this is not the best time, because during the New Year, the holidays, you have a crowded transportation network, people going to and from different areas as they return, as we said, the largest human migration yearly for decades. So it's absolute formula for spreading it, people on crowded buses, planes, etc., breathing each other's air. So that was not the best time for this. But China's been dealing with it, and people have to keep in mind that what we're dealing with here is something which is shown, deadly, but at only 3%. That's not to be sneezed at, especially if it's somebody close to you who is being affected in terms of that's the mortality rate. But quite different from MERS, which has been more recent, and that is a 20% mortality, and SARS, which was 10%. If you start looking at flu deaths, and for instance, in the United States, last year, 45 million people were infected with viruses, 68,000 people died. This is, these are very large numbers. It's something that happens each year. China is dealing with it. I would take a little bit of a different view in terms of how I read the report, the written report from the WHO. I think it's clear that they are not trying to isolate China. Quite the opposite. They've indicated that they think that the rational approach is to monitor things at borders, ports, train stations, and airports where people are leaving. They do not want to interrupt the supply of goods and services. Remember,
that actually was
this is
a
a very
point they
serious
made, wasn't it?
incident,
Yes.
but there are many others going around the world.
Yeah, that was a point they made. Just a quick follow-up with you, Ina, that not to stop travel to China, not stop trade with China, and yet we see airline after airline stopping flying because sometimes the planes are empty. So how do you keep that going, considering the commercial pressures here? And of course, this is going to have an effect on China's economy as well, right?
Well, yes, and here's the real danger. It's called panic. People are feeding off the social media. They see things on there. You're seeing these pictures being circulated of, overtaxed health systems and things like that. But this is a very, very small snapshot. And what it's doing is making people more afraid. And this is what you have in these situations. The only way to combat it is exactly what is happening. Absolute transparency. In 2005, there was a law, not a law, but a convention passed that there would be free sharing of information, transparent, between all countries, especially when it involved a health emergency, and it has been declared. China has been doing that since the first moment. As we've talked about before, China was able to decipher the genetic code within a few days, as opposed to 1 year that it took in 2003 to do the same thing for SARS. So there has been progress. There has to be better lines of communication. People have to rely on the official accounts, which are very, very credible at this point, rather than being buffaloed by this kind of social media instances, personal testimonies and things like this. These are not the real picture.
I know, I'm glad you said that, because my social media feed all week has just been slightly hysterical, and there have been some sensationalist news outlets as well that are really sort of not helping here. Dr. Ding, you wanted to come in?
Oh, yes. But what makes this virus very different, and as U.S. former CDC Director Tom Frieden pointed out, it took 3 months for us to hit 8,000 cases globally.
But this is faster.
But we've already hit about 8,000 in 1 month. And SARS, this virus is less, in terms of mortality, dangerous as SARS, but it can spread even when you're asymptomatic, which is not true of SARS.
So it could be basically look perfectly fine, feel perfectly fine.
And
then
it is transmittable. For example, airport thermal screening, there was a London School of Tropical Medicine Hygiene study that came out that says it's only 9% effective. It only detects 9%
So then
of
if someone
cases.
took your temperature at an airport, it may 91% would go through.
Right, exactly. So it's only 9% effective, 9 out of 10. And so that also shows that, the traditional methods we use for screening and quarantine also does not work. I'm not trying to incite panic, because this is less dangerous than SARS or MERS. But at the same time, this virus is brand new, and unlike flu, no one has immunity, and we have no vaccine. It will take at least half a year to a year to get the vaccine. So there's still a lot of work to be done.
Thank you. Dr. Shafter, in the last few hours, obviously, we heard of the first case where in the US, where it's been transmitted human to human, and that may sound alarming. It was expected, and this was a woman who traveled to Wuhan from Chicago, went back and gave it to her husband because of close contact. This wasn't just a sort of random connection. But what does this mean for the US response?
Well, what it means is that the system is working. You said it correctly. We anticipated that there would be some spread. So the husband was a known contact of a case, and he was informed as soon as he became ill. He notified the healthcare providers. They cared for him, put him in isolation, and so the system is working. We can expect more cases. There will be bursts of transmission, I anticipate, but I don't think there will be very long chains of transmission. I don't think that the introductions of the coronavirus into the United States will set off large outbreaks in this country.
Why is that?
Well, it's because the diagnostic acumen of the doctors is all aroused. We all have this top of the mind. We're asking every patient who comes to us now with any kind of respiratory infection, have you been to China or have you had contact with someone who's just returned from China? So we're on the ball, working very closely with our public health authorities.
Dr. Shi, before I get to you, I'm going to play you another clip, because obviously we talked about the robust response from China, the excellent medical system here in the United States, and how the whole of the medical community is asking the right questions. But of course, the WHO said one of the reasons that they're launching this public health emergency is because of other countries that aren't prepared. Let's just listen to the WHO director, and I'd like to get your response off the back.
Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it. Let me be clear. This declaration is not a vote of no confidence in China. On the contrary, WHO continues to have a confidence in China's capacity to control the outbreak.
So, Dr. Shi, where is the WHO most worried about? China's neighbors or elsewhere? Where do you think that they are most concerned and this declaration will help with?
Yeah, I think since WHO has many country members who are small countries, very vulnerable to this outbreak, so they really want to enhance their preparedness to facilitate access to diagnose.
Yeah, China borders 14 countries, so where do you think the WHO should be focusing its attention in the region and beyond?
Since WHO have many member countries, and many of those countries are small and vulnerable to this virus outbreak, so the WHO was trying to make sure every country is being able to respond and facilitate their access to the therapies, potential vaccinations, and all kinds of diagnosis measures to be taken. So they are standing at the global level, and also they're worried about, since in the past few weeks, the outbreak has already reached 5 regions, all 5 regions of the WHO regions. So within 1 month. And the human-to-human transmission is not only in Germany, but also America and other countries. And there are still unknowns. We do not know the origin. So that's why so many uncertainty. So the WHO has been making some precautions measures to make sure every member country is able to respond. And this measure will be able to share full data, especially for many small countries. They have no capacity to have those data, capacity to analyze those data, but through international coordination at the global scale. So we probably will be in a better and a safer place to share information and combat this virus outbreak.
Although China's response has been massive, we have seen shortages, for example, of, say, masks, Dr. Shi, and other things. Yeah. How does the WHO now make sure that these sort of supplies get everywhere, not just in China?
So I think, firstly, we need to have no misunderstanding about this statement, because this doesn't say like China as a country per se is dangerous. It's about this outbreak. It's an epidemic. So after a few months, or even within 3 months or less time, they could remove this emergency. And this has to be understood. It's not like forever or for quite a long time. And also, this is like a recommendation, very temporary recommendation, and there's no further measure of restricting the trade and travel and all this stuff. So, and the WHO wanted to coordinate the measures to help China to contain the outbreak within the border of China, but also across borders, because nowadays still over 99% of cases are still within China. So it's a very important stage to make sure that it's not reaching out to all the countries.
I know we all remember the SARS outbreak of 2003, and obviously China and viruses have come a long way since then, especially with its work, for example, on Ebola alongside the US and other scientists. What lessons have been learned from that time and how they're being applied?
Well, you know, a lot of lessons. First off, making sure that the information flow is accurate and spread to everybody, coordinating with international bodies, being able to identify, that was the genome sequencing, which was done in, you know, relatively incredibly short period of time. Then you're talking about control of spread. That's the phase that we're in now. People should be aware that this is going to continue for a while. We have not peaked. In all probability, there could be at least 3 or more weeks when you're continue to see a kind of a rise. And then the last part is trying to develop a cure or vaccine that can prevent this kind of thing from happening again in the future, especially with this strain. So what China has learned is that you have to take this very seriously. There are obviously protocols that were in effect immediately when it was declared within China that this was a health emergency, and they went ahead and this. Really what's very important is that I believe China is using artificial intelligence. This is an instance where we're seeing, you know, what we've talked about at work, the ability to model real-time information and make decisions based on the facts rather than, you know, kind of subjective ideas or, you know, anecdotal evidence. You can really see the spread, and because you can model that, it puts China in a much better place. Now, keep in mind throughout all of this that China is taking extraordinary measures, and that this declaration was not against China, but a protection for the rest of the world, a wake-up call that they need to take this thing very seriously.
You know, Dr. Schaffner, one of the amazing things is that the work on a vaccine has sort of begun almost immediately after that code was released, and a lot of work going on the west coast of the US. This just shows incredible globalization and the connection of health professionals, especially when combating these viruses, to me. So what can we expect in terms of a vaccine? And as Dr. Ding said, it will take several months, but will we essentially get a vaccine so everyone just get a jab in the arm going forward?
Well, we're all optimistic, you know.
Right.
We have to hope that all things go well. But it really is wonderful because this production of a vaccine is going on internationally. There are several paths scientifically to trying to develop a vaccine. They're all moving simultaneously. There is a lot of communication already between the scientists. And so my fingers are crossed. It will take some time because first you have to create the vaccine candidate in the laboratory, and then of course you have to test it in volunteers to make sure it's safe and effective. So that will take a bit of time, but it's proceeding at a pace that is unprecedented. So that's very exciting. And in addition, there's research going on therapeutic agents so that if you get sick, we might have a treatment. That also is a little bit down the road yet, but nonetheless, work is on board and underway.
Dr. Ding, you wanted to pick up on that?
Yeah, exactly. And those therapeutics, actually, because this virus is an RNA virus.
What does that mean? Sorry, therapeutic exactly.
What he means, I think, correct me if I'm wrong, antiviral drugs that, for example, we use and developed for HIV. HIV is an RNA virus. This works a little bit differently, but these viruses...
Like an antiretroviral.
These antiviral drugs, retroviral is one type, and like for example, protease inhibitor drugs used to slow the progression and the replication of HIV. So
it's not a cure, but it can manage the spread.
It can potentially slow down.
Yeah.
And many researchers are also testing the old SARS vaccine as a starting point, even though SARS is
modifying
79% related. It's not that close of a virus.
Okay.
So, but I think between chasing a vaccine and also testing these existing drugs like protease inhibitors that can potentially slow the progression and transmission, I think we have lots of good hopes in the near future.
Thanks for that. Dr. Shi, now this is going to be a little bit sensitive because it's where this virus came from. And as you know, there have been all sorts of theories, some of them conspiracy theories, and let's face it, some of them pretty culturally insensitive, if slightly downright racist, actually, in the last couple of weeks. So what do we know about that without trying to sort of inflame the debate more than it's already been inflamed, Dr. Shi?
So I think declaring this as an international emergency is a better solution to to stigmatize any country or any race or ethnicity. So actually it become a global epidemic, and everyone could be infected. So it's not only Chinese or Asian or any group of people. So this become more global epidemic. So that also calls for coordinations and sharing of information resources, coordinative strategy across those countries. So I think the WHO really wants to send a signal or calling for global level coordination instead of like a signal of penalizing any country for any wrongdoings, because China already did very extraordinary measures to curb and contain those virus. And those things would not be achieved in many other countries without a very strong government and those measures.
I know, in terms of the cause, and we've all read the stories about potential links between wild animals. How's it been playing out in China? Is it too early for that?
No, the government has been taking very strong measures to make sure that any source of contamination, the creation of this virus is attacked. There are the theories that this was developed in Wuhan. There was a number of individuals who were at a wet market. And by wet market, I mean a place where they kill the animals and skin them, and there's a lot of blood and things like this, and not clean conditions. I think you're going to see that change. But they noticed that there was that seemed to be the epicenter of that. So that is what they're not proven. But this is a strong suspect in this. Now, this idea of eating wild animals, all of a sudden there's this idea that it's all China's fault. But quite frankly, this happens around the world. In most non-developed countries and even in developed countries. Cast your mind back to chronic wasting, mad cow disease that developed in the United States. This is a situation where hunters were getting it because they were eating the vulnerable parts of deers, mainly organs in the brain, that was not cooked enough, and they were getting this kind of disease. Now, it wasn't as communicable. But quite frankly, this kind of blame game is not going to be to the point. The question is, how do you go forward in the future? How do you make sure, as much as possible, that these things don't occur?
Ina, I think that's a good point to end on. And can I just thank everyone, Ina, Dr. Schaffner, Dr. Shi, Dr. Ding, just for giving us the facts and not being hysterical and calming everything down, because there's been just too much of it. And that's all we have time for on this edition. But of course, we'll be bringing you more on the coronavirus and the battle to basically stem it, and all the WHO and Chinese efforts as well. Well, that's it from this edition of The Heat. I'm Nathan King in Washington, DC, and thanks so much for watching. Really appreciate it.
Hello everybody, I'm Anand Naidu. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week we take a deep dive on world headlines, talking to experts, journalists and others. It's a fresh, focused and intimate look at the issues that matter most. Whether it's the Hong Kong riots, the latest Middle East conflict or US politics, The Heat podcast gives the clear context needed to understand both what's going on and why. And what's best, we come to you. Whether you're at home or on the go, you can find The Heat podcast just about anywhere podcasts are found. Just search The Heat CGTN. Have a listen today and subscribe. Thanks.